One of the most common images associated with nursing is giving shots. While giving immunizations is a big part of nursing, the process of immunization is much bigger than just giving a shot. It includes promotion and education of both yourself as a healthcare professional and of your patient. In our video today, we hope to help educate you on the significance of immunizations and Healthy People 2020's goals to promote them, as well as give you some ideas as of how to help patients get educated about vaccinating. In this video, we use both the terms immunization and vaccination, and we want to make sure that you know what both of these terms mean. Immunization is the process by which your body undergoes to become immune to a disease, whereas vaccination is the actual injection that is given in order to produce immunity to a disease. These are important distinctions you need to make in truly understanding what we are saying as healthcare professionals.
First, let's talk about why immunization is so important. According to Healthy People 2020 and data from the Center for Disease Control, vaccine-preventable diseases are a leading cause of death in the U.S. The CDC recommends vaccines for many diseases that you can be affected by commonly throughout the lifespan. But there are thousands of illnesses and deaths each year that could be prevented if more patients receive these vaccinations. For example, for each age group that gets vaccinated with the routine immunization schedule as babies, 33,000 lives are saved, 14 million cases of illness are prevented, and over $40 billion in care costs are saved. Again, those statistics are provided by Healthy People 2020. Healthy People 2020 has a goal to increase immunization rates across the board and therefore reduce preventable infectious diseases.
These charts are provided by the Center for Disease Control, and they show the recommended vaccination schedule for birth to 18 years and for adulthood. As you can see, there are many different types of vaccines for different diseases that are given at different points in the lifespan. It is important in your role as a nurse to be able to educate your patients on when and what vaccinations they might need.
We have 2 student learning outcomes for you today. These are big points that we want you to take away from our video. They are, number 1, staying up to date on immunizations is important because they can prevent deaths and diseases from occurring. And number 2, as a nurse, it is important to be knowledgeable about the purpose, methods, and requirements for immunizations so that they can help patients make informed decisions about vaccinating. One huge way that we can meet this Healthy People 2020 goal is by educating our patients well about immunizations. Here's a scenario where a nurse educates a mom about vaccinations.
Are there any other questions you have about your baby today?
Yes, actually I was going to ask you about immunizations and vaccines for my child. Being a new mom, I'm really worried to give an immunization because I've heard that sometimes after babies get them, they get sick, or that the immunization is basically just giving them the disease. So I was just wondering what you could tell me about that so then I'd be better prepared because I myself haven't had very many immunizations.
Great question. Vaccinating is actually one of my biggest recommendations to new moms. While some vaccinations do use a very small and weak amount of the virus in order for your body to start building up an immunity to it, it's still very safe and not enough to hurt you. Some vaccinations might have minor side effects, but they've all been tested many, many times, and the risk of side effects is much, much less than your baby getting sick.
Yeah, that makes sense. I wouldn't want my baby to get sick.
Also, you mentioned that you haven't had your own vaccinations in a while. Did you know that it's recommended that adults get immunizations as well as children?
I didn't know that. I never really have been faced with getting them.
Even though you've made it this far without getting sick, there's still a good chance that you could, and we wouldn't want you carrying any diseases that could get passed on to other people.
That makes sense. I want to keep my baby and myself healthy.
Exactly. So it's recommended that someone your age gets a flu shot every year. And we should find out if it would be a good idea for you to get a meningitis vaccine as well. Let's also take a look at your medical records to see if you need to get caught up in any vaccinations that you didn't get as a teenager. Does that sound good?
Yeah, sounds good to me.
I want you to be the healthiest mom that you can be.
I want my baby to be the healthiest baby it can be.
Okay, well here's the recommended immunization schedule for little ones. It looks like right now your baby needs to get a hepatitis B shot. And then in about a month, we'll start her on some other vaccinations. Protecting yourself from disease is a lifelong process, and I'm so glad that you're taking steps to make sure that your family is healthy. Take a look at that and let me know if you have questions about anything.
All right, thank you for all of your help.
You're welcome. Let's make some appointments. Let's evaluate that scenario. This demonstration shows how big of a role nurses have in educating their patients about immunization. The nurse in our demo uses language and examples that the new mom can easily understand, like the way she describes how vaccines are made in simple language rather than in medical terms. She also reassures the new mom of the safety of the vaccines and gives her additional information in the form of a pamphlet. One big thing the nurse does for health promotion is to encourage the mom, as well as the baby, to keep up with her shots. The nurse also encourages questions, which is a great way to gauge patient understanding.
Although this scenario is a good example of how a nurse should promote wellness, things won't always go quite so smoothly when working in real-life patient situations. The patient may not respond to the education as positively as shown in this scene, and your wellness promotion efforts might not always change the patient's viewpoints. In your nursing role, remember that your job is to educate and encourage health promotion from a non-biased standpoint and to advocate for patients so that they can make medical decisions that fit in with their own beliefs and cultural choices. Even though real-life situations might be a little harder to navigate, our scenario still shows good practices. In conclusion, immunizations are an important factor in staying healthy, which is why, as a nurse, you need to promote immunizations to all the patients you can. However, if you are to promote it to patients, you should also, as a nurse, have an understanding yourself of what an immunization is, how critical they are, and what specific immunizations there are to educate your patients on this important information. This will help reduce worldwide preventable illness and death and help reach the Healthy People 2020's goals of promoting immunization and preventing disease.
We just want to remind you of our student learning outcomes for this video. As we talked about in our introduction, and as we demonstrated through our nursing roleplay, staying up to date on immunizations is very important because they prevent deaths and diseases. Also, as a nurse, it's important to be knowledgeable about the purpose, methods, and requirements for immunizations so that you can help patients make informed decisions about vaccinating.
Make sure to go check out the 2 questions that our professor has posted at the end of this video. We hope that you have learned a lot and will now seriously consider promoting immunizations to patients in the future.